Welcome back to Better Arizona, everyone. I'm Sarah Karlstrom. Today we're going to be talking about something that really affects so many of us at one point or another, and some people it affects a whole lot worse. We're here at AZ Pain Centers, and I'm with Dr. Tricia Croake-Uleman, and we're talking about chronic back pain. I know for me, a lot of times I wake up, I've got a little ache or a little pain. It typically goes away. For a lot of people, though, it's actually a chronic condition.
Absolutely, absolutely.
Why is that?
Why is that? Well, what happens is with a lot of people, they start the pain cycle. You start with the pain, maybe they re-injure it, maybe they don't, maybe they never take care of it. And it gets to the point where the nerves are inflamed and you need to stop that. You got to stop the pain cycle. And that's what we do here with the injections that we use, is to get the medicine in there to stop that pain cycle.
And I want to talk about injections in just a second, because typically I'm reaching for the Advil or the Tylenol, and people really do that for a long time. But is that a bad thing?
It can be, absolutely. I mean, you use it every now and then, it might be okay, but over time it can cause problems like gastritis, ulcers in the stomach, things like that. It can cause kidney problems. So it's not something you want to take for a long period of time.
So it's basically just masking your symptoms.
It is, yeah.
So at what point then, doctor, I've got back pain, it's really bothering me. How often is it bothering me? Daily, weekly? I mean, when is it a problem?
Well, that depends on the person, Some people will have it, once a month and say, oh, it's not a big deal. Other people will have it on a daily basis, and it's really affecting their life. They're having problems getting up and getting their kids to school or getting to work. And, it's really, that's kind of subjective. When does it start to bother you to the point where it's affecting your life?
It's probably when people go to the doctor.
Yeah.
And so,
but some people don't.
Really? And
they just want to, they're stoic. I don't need this. I'm going to do this on my own. And I can see that because a lot of times you go to the doctor and you are given medications to mask it. So I kind of see their point of view. Why do this? Versus when you come here, we're actually treating it.
And here's the thing. You can actually live a life
absolutely
that's pain-free.
Yeah.
So let's talk about what's going on here at AZ Pain Centers that's not going on elsewhere. So I'm taking Tylenol, Advil. Here it's a different approach.
Correct.
Tell me about it.
Well, what we do here, you also see, people will go on to the doctor, they'll get things like narcotics, and of course you don't want the narcotics. People become addicted to that. You have problems with that. People will be put on steroids, and steroids cause a lot of problems on their own. They'll cause bone loss. They can cause problems with the adrenal system or your hormones, the endocrine system. So you like to stay away from that.
And we say steroids, that's what like a cortisone shot would be, right?
It could be a cortisone shot, or you can take it by mouth also. People will be given pills for that also.
Okay.
So, and it decreases the inflammation. It usually feels pretty good when you're on it, but it's wreaking havoc on your body. So it's not something you want to do really ever, and definitely not on a regular basis. So what we do here is we do injections with non-steroidal. We have a non-steroidal anti-inflammatory working with a couple other things. It's more natural, and so it doesn't cause any problems with the gastritis, the bone loss, the endocrine problems. And it gets to the source. We're going directly to the source of the pain so that it can cut that pain cycle, so it can decrease the inflammation. Maybe the first injection doesn't take care of the pain all the way, and that's why it's a series of injections. But as long as we get relief within, first or second, the majority of these people are,
And when you say relief, doctor, what do you mean?
Pain-free.
Really?
Most people are pain-free, yeah, or at least get to the point where their quality of life is much better. They're able to, get up with their kids. They're able to go to work. They're able to play golf. They're able to do some of the things that they enjoy.
Or even bend over, stuff like that. So you're talking about most people. So are you saying that most patients with chronic back pain, they really respond to this?
They do, absolutely, absolutely. The vast majority of people who come through these doors, we are able to help.
Well, fantastic. And of course, I know people at home, if you're interested, you probably want to check out their website and get a lot of information. That is azpaincenters.com. You can also give them a call at 480-821-PAIN, which is 7246. Again, azpaincenters.com. Or you can also check out our special health website at AZ Health Spot and click on the AZ Pain Centers. Well, Dr. Croake-Uleman, thank you so much. Interesting information. A lot of relief for people out there. And Better Arizona will be right back.